If you have a Plan N or you're considering Medicare Supplement Plan N, there is some important information that you should know about the copays that you may be responsible for. And we are going to cover that today, so stay tuned. Medicare Supplement Plan N is becoming more and more popular, and in many areas it offers a really excellent value and very comprehensive benefits as well. Let's break down how Plan N works. Plan N covers almost all of the Medicare Part A and B coinsurance and cost share. So with Plan N, you do not have coverage for the Medicare Part B deductible, and that means that you have to pay the first $198 of your medical expenses for any type of Part B service before your Medigap Plan N kicks in. Plan N does fully cover the Medicare Part A hospital deductible and coinsurance, so you would pay $0 for an inpatient hospital stay. The Plan N copays come into play after you've satisfied the Medicare Part B deductible, the $198 deductible. So after you've paid the first $198 of your medical expenses, your Plan N kicks in at 100%. However, you still have to pay copays of up to $20 for certain office visits and copay of up to $50 for an emergency room visit. And this is one of the big things that makes Plan N different than its popular counterpart, Plan G, is these copays. With Plan G, there are no copays. With Plan N, you do have copays that you may be responsible for. But we've helped many people with Plan N who, once they start using their plan, are actually surprised to find that those copays aren't as much or happening as often as they had expected them to. So if you have a Plan N, when can you really expect to have to pay those copays? I'm going to refer to a document about Plan N that was created by CMS, which stands for the Centers for Medicaid and Medicare Services, and the NAIC, the National Association of Insurance Commissioners. And this document offers guidance on which CPT codes will trigger the Plan N copay. So you'll see here there are a whole list of CPT codes that will trigger the Plan N copay of up to $20. These codes, and you can search them online, mainly apply to general office visits for evaluation and management. There are some online resources you can use. I will link those below where you can actually search CPT codes and search for which types of CPT codes to expect for certain services. For example, many specialist office visits are not subject to the copay, and chiropractic and physical therapy ongoing treatment visits are generally not subject to this Plan N copay as long as they're coded correctly. Additionally, you'll see in this Plan N guidance document that online office visits, telephone, and telehealth visits would not be subject to the Plan N copay either. And with everything that's happening in the world right now, more and more people are using telehealth, and it's nice to know that you would not see a copay for those visits with a Plan N. Now, Plan N also has a copay of up to $50 for an emergency room visit, and that copay is for the entire emergency room visit, including any doctor's fees or tests that you would have done in the ER. That Plan N $50 emergency room copay is waived if you are admitted to the hospital. So if you are admitted as inpatient, that copay would be waived, and you would have $0 deductible and copay for an inpatient hospital stay. So when you break down exactly how the Plan N copays work, it does make Plan N a bit more attractive, especially in areas where Plan N is priced significantly lower than Plan G. It's definitely a plan worth considering. The other big thing that makes Plan N different than the popular Plan G is coverage for the Medicare Part B excess charges. And now these are really very rare, but they are something that is covered by Plan G, not covered by Plan N. And I'm going to link a video below that we did that shows you some more information about excess charges, how they work, how common they are, and if you should be concerned with those. And again, I'm going to link that video below, so check it out. Another reason that people like Plan N is that it does offer a really good value when you look at the long-term rate increases over time compared to some of the other Medigap plans. So on the screen right now, I'm showing some rate increase data, and agents are not really supposed to share this. We have the insurance company's name kind of blacked out there, but this shows you how different the rate increases on Plan N are compared to some of the other Medigap plans. You can see they're significantly lower than the other Medigap plan offerings. Now, this is just one insurance company. It's just one example, but it's definitely something to consider when looking at your Medigap plan options. If you would like any more information or are interested in seeing rates for Plan N in your area, please feel free to reach out. I'm an independent broker, so I independently work with most all of the different insurance companies in almost every state nationwide, and I would be happy to provide you with free, no obligation quotes. Our service is completely free. There's no charge at all to you to use an independent broker, and your information is always kept secure. We never share anything with a third party. So if you would like to reach out to us for quotes, we'd be happy to help. And if you have any questions, please leave them below in the comment section. I always answer the questions, and we'd love to hear what you have to say. Thank you so much for watching, and we'll see you soon.